Mike Gibson, David Gaudet coming to you live from ACC 2024, and we're talking about a new treatment of hypertriglyceridemia, Plozasiran. David, talk to us a little bit about your study and what you found.
Yes. First of all, Plozasiran is a small interfering RNA, thus meaning that it interferes with the translation of the POC3 gene, affecting the production of the POC3 protein, which is a key player in POC3 in the management of uh, lipoproteins, particularly triglyceride-rich lipoproteins, including chylomicrons, which are the largest lipoproteins or proteins being produced after a meal in the gut, and the VLDL particles produced by the liver. And eventually, VLDLs are the source of the LDL particles, which are well known. So reducing triglyceride in these lipoproteins has a potential of providing huge decrease in TG levels and eventually to prevent morbidity associated with severe hypertriglyceridemia, including acute pancreatitis, which is caused by accumulation of chylomicrons, the post-meal lipoproteins, and or other morbidities, including atherosclerosis eventually. Also, it has been observed that the POC3 inhibition has also a favorable effect on fatty liver. So obviously, what we are talking about here is a phase 2 study called SHASTA-2. And this study was not designed, it was not an event trial. It was not designed to assess the efficacy in preventing cardiovascular disease or pancreatitis, but very specifically, it was a placebo-controlled, double-blind, dose-ranging study assessing the efficacy and safety of Plozasiran, the siRNA, in decreasing TG levels after 24 weeks of treatment. And then this period of treatment has been followed by an additional 24 weeks of follow-up for safety and additional efficacy assessments.
What did
So,
you find?
mhm.
What did you find?
Well, first of all, this study, I will talk a little bit about the study itself. The
Yes.
study involved 29 participants from 8 countries, mean age of 55 approximately, and majority being Caucasians and male. Plozasiran is an RNA, so it doesn't require frequent administration. In this case, it has been administered every 3 months. In this study, it has been administered at baseline at 12 weeks, and then these patients have been followed for an additional 36 weeks for 48 weeks follow-up total. There were 4 doses, the placebo, and then the 10, 25, and 50 milligrams. So what we have observed is that 90% of those having received Plozasiran, which they all add very high TG levels at baseline. I mean, above we were talking about patients with severe hypertriglyceridemia, meaning TG levels above 500 milligram per deciliter. And the median level of TG in each group was above 650, so very high TG levels. And just to let you know that the risk of acute pancreatitis increases linearly with TG levels above 500. The majority of patients with pancreatitis have values above 1,000. So in this case, all participants in the treated groups could, whatever the dose, could be 10, 25, or 50 milligrams, 90% or more of patients showed decrease of TG below 500. And 50% showed decrease of TG levels below 150. So they normalized literally their TG levels, which is, we were expecting TG lowering. We were expecting an important TG lowering based on the previous data that we have acquired over years with other ApoC3 inhibitors. But with an RNA, so with an injection every 3 months, it was very interesting. And more interesting, I would say, is that despite the fact that in theory, it has to be injected every 3 months, given the PK data, the observation phase, which was 36 weeks. So the patients after the second injection, they were injected at baseline and at 12 weeks again, but they were followed for 36 additional weeks. And at the end of the 48 weeks observations period, they still presented very, very significant TG, low TG levels. So the effect was sustained. So what it means is that and it was safe. I mean, very well tolerated. The most important side effect or adverse event was COVID-19. We hope that we will never have to deal with this again. But for the rest, was well tolerated. The only what I will call it observation which required attention was some modification of or exacerbation of the glycemic control in some patients with type 2 diabetes. But we know by experience again with other ApoC3 inhibitors that this effect is probably transient and just reflecting the huge effect on TG levels and the production of free fatty acid. So by the end, it has been effective, it is safe, and the conclusion is that well, it merits pursue of the development, the eventual phase 3 program, assessing the other parameters in a larger patient population
Of
and more
course.
diversified patient population, obviously.
Wow, great news. I mean, for someone like me with hypertriglyceridemia, this is very exciting. Well, thanks for joining us, David, today, and thanks to all of you for joining us here live from ACC 2024.